My name is Samantha Thompson, and I was the vet technologist who took care of Bella this afternoon at the Robinson Vet Clinic. It's a pleasure to meet you. So, Bella just went under surgery known as a variant hysterectomy. It's also more commonly known as a spay. This involves the removal of her ovaries as well as her uterus. Does that all sound correct with you? Okay, good. She will no longer be able to have puppies and no longer be in heat. But a humongous benefit of what you guys did is she reduced her chances of having breast cancer by an astonishing 7 times. Bella is currently doing amazing after her surgery. She may be a little groggy for her days, but that's perfectly normal. Some signs and symptoms to look out for is oozing or swelling or redness of her abdominal incision. This does not show a healthy healing process, and we should get it looked at as soon as possible. These symptoms arise, please call us so we can get in there and look at it. She should also not be vomiting. Could you please repeat back to me some of those signs and symptoms, just so we know we're on the same page? Swelling, throwing up, okay, yeah, sounds great. Yes, that's exactly correct. We also ask that you limit Bella's movements for 7 to 10 days. We don't want her running or jumping or rough playing, anything that could get that site to open up. We also want her to be indoors if it's possible, but if that's not quite the case, a kennel or even a garage would suit her very well during her recovering to ensure she's in the least amount of pain as possible. Would that be something you guys could come up with? Okay, yeah, indoors, that's great. So she will be sending home a Rimadyl, which is a chewable pain tablet that Bella must take at 1 tablet twice a day for 4 days. I also sent home this instruction sheet that should help you remember the times that she needs it. So what it says is please give 1 tablet by mouth twice a day for 4 days, as needed for pain. Then we have the dates listed, as well as the times, and an even little check mark box where you can check it off as you go, so we can know that she got her dose at that time. Have you ever given an oral pill before? No? If you'd like, I could show you exactly how to do it. Bella's about due for hers anyway. Yeah, sounds great. Absolutely. No problem. So we want to take the pill, and we want to open up her mouth wide. Careful for your hand placement, as we don't want her to be able to bite us. So we want to put it deep into her throat, shut it, and rip her throat. Does that sound all right? Okay, so I will do it for real this time. Open, in, rub. In case you may forget how to do it, I'm also sending you at home a little sheet that has pictures and a description next to each one. It says, Step 1, take a pill out of the bottle. Step 2, carefully open the dog's mouth. Step 3, with your hands in the position as shown, insert the pill deep into the throat. And step 4 says to rub the throat and close the mouth to ensure swallowing. Any questions so far? No? Okay, sounds great. We don't want Bella licking her incision site at all, so do you think that she would do that, lick or chew at those? You don't think so, but you're not sure? Okay, well, we could send home what's known as an e-collar, and what that is, it's a clear plastic collar that will block her view of her abdomen so she can't get at it, lick at it, scratch at it, any of the things that some dogs may do. Have you ever placed an e-collar before? No? Okay. I sent home the last and final handout for the night, which is how to properly place an e-collar. Step 1 is to lay out the e-collar. Step 2, we want to measure around her neck to find the appropriate size that she may need. Step 3, we want to thread the loop into the holes at the appropriate site. Step 4, we want to place the e-collar on. Step 5, we're going to take a piece of gauze and thread it through those loops. And we want to knot it real tight so it won't go anywhere, but not too tight so she can still breathe. That's all the steps for any color. Any questions with that? No? Sounds great. Alright, so we don't want Bella getting into any water, as that could also hurt her incision sites. We don't want her swimming. Please don't put anything on it, as that could affect the healing process as well. Please try to keep her away from baths as well. I know you may think that it would be helping, but we want to make sure that her healing process goes as fast as possible. Alright, so any further questions at all? No? Okay. Well, before you head out, we want you to schedule an appointment for a follow-up, which would be a removal of the sutures in 2 weeks. You can either call and do that, or you can go straight to the reception desk and she'll be able to fill out a time slot for you there. Any further questions? No? Sounds great. Well, you have a great day, and we'll see you in 2 weeks for that removal of that sutures.